Chris, thank you. Well, today is an historic day in Michigan as same-sex couples can get married for the first time. But another major milestone is quickly approaching, the deadline to get covered under the Affordable Care Act. Joining us this morning is Kohn-Parrott from the Greater Detroit Area Health Council, and she's answering some really important questions before the March 31st deadline. We're so glad you're here.
Thank you. I'm pleased to be here. It's an important topic.
Yeah, it is. So this March 31st deadline, tell us, what happens? Obviously, there's a penalty. Explain this.
Sure. So under the Affordable Care Act, there's two major provisions related to insurance coverage. One is what's known as the employer mandate, and the other is the individual mandate. The deadline for enrolling in coverage for 2014 without paying a penalty is March 31st for individuals. So this deadline counts for individuals only, not employers.
Okay.
If an individual does not enroll by March 31st and have coverage, that individual then would have to pay a penalty. The penalty is the greater of $95 per person per year, or 1% of their income.
Okay.
And so there, but I say, that's the penalty may or may not apply because the government has set up a number of exemptions for individuals.
Okay. And there are so options out there. We've heard so much about private and public exchanges. What can you tell us about that?
Okay, sure. What we're talking about today with the March 31st deadline is known as a public exchange or a marketplace. Mm-hmm. The private exchanges are available to employers. They may decide to offer their health coverage or an array of benefits through a public exchange, through a private exchange to their employees. But if your employer does not offer a private exchange, you cannot enroll through a private exchange. So we're again talking about the public exchange, and that's the deadline of March 31st.
All right, and here in Michigan, we also have another milestone approaching with Medicaid expansion. That is April 1st. Talk to us about that as well.
That's great. That is our Medicaid expansion. It's called Healthy Michigan. This will provide coverage for up to 320,000 people in the first year. It is effective April 1st, the coverage. However, the first day that you can enroll is also April 1st. The state has not yet announced the website for how to do that, but that will be coming out soon, and I think people need to stay posted. Basically, individuals who make under $11,000 a year or families who make under $34,000 a year, there would be a family of four, could qualify for enrollment in Medicaid, the Healthy Michigan plan. However, people who don't know for sure if they would qualify are encouraged, strongly encouraged, to go on to the public exchange and try to enroll there in order to learn if they can get Medicaid coverage or not.
And so people are watching right now maybe debating on whether to get covered or pay the penalty. What would you say to them?
Okay, so we can't direct people on whether they should get coverage or pay the penalty. The important thing is to work with a navigator. So there is a website called enrollmichigan.com. I would encourage anyone who's considering that to go to the enrollmichigan.com website. It will guide you to a navigator, and a navigator is someone who's trained and licensed to be able to help people make decisions on their insurance coverage. A couple key things that people need to keep in mind. They're going to talk to you about premiums. Mm-hmm. That's the amount that you would have to pay on a monthly basis. And you may be likely to choose a plan with the lowest premium because it sounds the most affordable. However, it may have very high deductibles, so you have to really look at the whole picture. That's why a navigator is so very important to help people make those decisions. The other things that people should know, you have to do this online at this point in time. We're so close to the March 31st deadline that you cannot use a paper process and expect that you would get coverage. If you are not enrolled by March 31st in some type of coverage, and this does not apply to people who have coverage already, you don't even have to worry about that date. But if you're not enrolled, you may be subject to a penalty. And the other key thing for people to know is once you get coverage, you really need to learn how to be an educated consumer and how to take best advantage. One of the things I would encourage people to do is forge a relationship with a provider or a doctor. Don't go to the emergency room for visits for, earaches and so forth, but make a relationship with the provider.
All right, Kohn-Parrott, thank you so much. Very valuable information.
Thank
We're going to have the details on our website, WXYZ.com. Just check the Scene on 7 section. We'll be right back.